Hello students, good morning. I am Dr. Mathew Jacob, Associate Professor from the Department of Oral Pathology and Oral Microbiology of Vinayagar Mission Shankaracharya Dental College. Today we will be discussing on the mandibular canine. My presentation will comprise of the following. I will start with a brief introduction and follow it up to the clinical aspects. To begin with, mandibular and maxillary teeth are formed in the alveolar bone and they move along the alveolar bone, pierce the oral mucosa and erupt into the oral cavity. So for today's discussion, as I have shown here, you can see it is highlighted in red. I will be speaking on the mandibular canine. We can see the maxillary arch and the mandibular arch. The maxillary arch comprising of the maxillary teeth and the mandibular arch comprising of the mandibular teeth. And the red highlights the mandibular canine. As we can see, the mandibular canine is the third tooth from the central incisor. In the tooth numbering system, that is the Palmer and FDI system, the mandibular canine is denoted by the number 3, as I have highlighted in red. And in Palmer system, we have two lines, that is a horizontal line and a vertical line. The horizontal line separates the maxillary and the mandibular teeth, while the vertical line separates it from the left and the right side. So as you can see in the Palmer system, the mandibular canine is written in beneath or below the horizontal line, and it is written as 3 on the left and the right hand side. And in the FDI system, the blue numbers, that is 3 and 4, indicates the quadrant, that is 3 for the left and the 4 for the right. And the 3 in red indicates the mandibular canine. So it is written as 3-3 and 4-3 for the FDI system. Next, we move on to the chronology of the mandibular canine. So as you can see in this tabular column, we have the first evidence of calcification that is seen at 4 to 5 months, followed by 6 to 7 years where we see the enamel is completed. However, the tooth erupts only at 9 to 10 years and the completion of the root occurs from 12 to 14 years of age. So here we see there is a 3 years gap after eruption and the completion of the root. Now this is just a schematic picture just to show the mandibular canine and how the eruption occurs. As we can see here very clearly that the maxillary canine has not yet erupted, and we have the mandibular canine which has pierced the oral bone, alveolar bone, as well as the oral mucosa and is moving into occlusion. And we can see here that again I repeat, the maxillary canine has not moved into occlusion. So coming to the morphology or the different aspects of the maxillary and mandibular teeth, when we study the maxillary mandibular canine, what we see is that the maxillary canine shares a lot of aspects morphologically similar to the mandibular tooth. So whenever we read the morphology, it is more or less compared with the maxillary and the features are more or less similar to what we say to the maxillary canine. So to begin with, in the crown, what we see is that the mandibular canine is narrow mesiodistally, and we can see that it is longer, that is the crown length is longer by around 0.5 to 1 millimeter. The root is usually shorter than the maxillary canine, and the crown and the root, if you see the labiolingual diameter, is just a fraction of a millimeter less, followed by which now we shall see the lingual surface. The lingual surface is smoother and has a lesser single development. The bulk is less for the marginal ridges, and it resembles the lingual surface of the mandibular lateral incisors, as I will show in the next slide. So this is trying to emphasize the lingual aspect of the mandibular canine. So we can see here that the cingulum is less pronounced, and we have the mesiodistal diameter is more narrower, and we can see that the whole length of the tooth is comparatively shorter than that of the maxillary canine. I have highlighted the ridges and the fossa, so I will be explaining to you here. We have basically 4 ridges: the mesial cusp ridge and the distal cusp ridge. We have the lingual ridge that is present here. Now if you see, the lingual ridge is in between the fossas, that is we have the mesiolingual fossa and the distal lingual fossa. Then we have the mesial marginal ridge and the distal marginal ridge. Beneath these we can see the less developed cingulum and the cervical line. This is the lingual aspect. If we were to observe the same tooth from the occlusal aspect, we can appreciate the mesial cuspal ridge, the distal cuspal ridge, and the comparatively less pronounced cingulum. Now, Moving on to the morphological aspects, when we see the tooth from the buccal or labial and the mesial aspects, a few points that has to be noted is, first, the mesial outline is straighter when compared to the distal outline. So as you can see here, I have marked the mesial outline is more straighter when compared to the distal aspect. The cusp angle is on line with the center of the root. That is, as you can see in this picture, if you were to draw a line, it will be almost equally dividing the tooth up to the cusp, from the cusp tip to the root tip. Next, we can see that the mesial ridge is shorter when compared to the distal cusp ridge. The distal contact area is more towards the incisal aspect. The cervical line, as you can see here, which is marked here, is a semicircular curvature and it tips more apically. And the curvature of the root, as you can see in this picture, shows a curvature towards the distal direction. Now, moving on to different aspects, that is the mesial, distal and incisal aspects. If you can see that it almost is symmetrical in both mesial and the distal aspect. That is, if you were to draw an imaginary line from the cusp tip to the root tip, what we can see is that the tooth is almost bisected equally when we draw a perpendicular line. This can also be similarly appreciated in the incisal aspect of the mandibular canine. Now here I would like to highlight that the cingulum is comparatively less pronounced as that of the maxillary canine, as shown in here, the curvature, as we can see that the cingulum is less developed. The next is we see the cervical line. As you can see on the mesial side, we can see that it tips more upward, as we can see a more upward tipping of the cervical line when compared to the distal aspect. And the distal aspect is relatively more flat, which is similarly seen in the posterior teeth. So what we see is that the mandibular canine is a part of the anterior teeth, and as the teeth moves backwards, we see that the cervical line in the mesial side is tipped more towards the cusp tip and more flattens as it moves more distally. Now moving on to the dimensions, if we see when these dimensions help in carving the tooth. So this is used as a framework for carving the tooth. So the measurements enable us to use this to give a rough framework of the tooth and length and its proportions. So we have the cuspal tip, the root portion, the mesiodistal width, the mesiodistal width at the cervical portion, the buccolingual width at the cervical portion, the cervical line in the mesial aspect and the cervical line on the distal aspect. So to begin with, the cuspal length is 11 millimeters, the root length is 16 millimeters, the mesiodistal width at the highest portion is 7 millimeters, the mesiodistal width at the cervical line is 5.5. So therefore when we carve the tooth, we can see that we have to generally reduce the size from the mesial in the crown as it moves towards the cervical aspect. In the buccolingual aspect, in the bulkiest portion of the tooth in the crown is 7.5. However, when we go to the cervical portion, it's just 7, that is around 0.5 millimeter less. Next, in the cervical line, when we draw for the mesial aspect, it has to be 2.5 millimeters above, and on the distal aspect, it is just 1 millimeter. Now here, what we can see is the contact point or the contact area. Contact points are usually occurs when the tooth moves into occlusion immediately after eruption. However, contact area is a term which we refer to the contact points which gradually due to occlusion and wear and tear becomes a contact area. So here we can see in the mandibular canine, the contact area in the mesial aspect is with the lateral incisor is more incisely placed, and the distal aspect when we move, we can see that it is more occlusally placed. So now this is from the incisal and occlusal point of view. You can see that it is almost in the midline, and this has already been shared before. This is just to appreciate the contact area and the contact points. What we see is that there is a movement from the incisal to the occlusal direction moving downwards. Now moving to the clinical aspects of this tooth, as we can see on this picture, these are the mandibular canine are different morphologies as well as root, particularly the roots. So we can see here that in the left and the second one, we can see that there are 2 roots, therefore 2 canals. Here we can see that the curvature is more sharp, the bending is more sharp. Here you can see that more, as I mentioned before, we usually expect it to be a straight tooth, but however we can see that there is a slight curvature in the lower third of the root. Here we can see that it is almost showing close attachment from the furcation area here, and then these are the single root possibilities which are there. The length can vary. So the clinical aspect of this is that sometimes when we do a root canal, there might be presence of 2 root canals and 2 roots. So while using a reamer or file or any endodontic instrument in root canal, there is a highly great chance of a perforation. So a proper radiograph taken, we can visualize the multiple canals which are present, therefore prevent and perforation that may happen. The radiographs can be an IOPA, or with the recent advances, we can even use comb CBCT to locate the canals. So a few points, that is, we can prepare flashcards thereby to prepare for the exams. That is, this helps us to answer a few questions, important questions. For example, few of the questions that can be asked is morphology of the mandibular canine, and we can compare and contrast the differences between the maxillary and mandibular canine. And the last is the chronology of the mandibular canine. Now, the textbook which is preferred to be used for dental anatomy is Wheeler's Dental Anatomy, Physiology and Occlusion by Nelson Stanley. Thank you for watching today's discussion on mandibular canine. I hope that these points will help the students to carve your tooth as well as to answer your questions in your theory and your practical exams. Thank you.